Before the heart failure, back when I worked a lot of hours, 60, 80 hours a week. And so I didn't have much time for other activities. But then once I moved to Virginia, my heart function had raised and I was doing a lot better and I was feeling good and started this when I started doing a lot of hiking.
We first saw him September 2018, I believe. He came in extremely short of breath, low blood pressure, fatigued. He was unable to get out of bed. He was so weak because his heart was so weak, it couldn't pump the blood around his body. So we have some intravenous medicines that we call inotropes that help make the heart pump stronger and support the heart. So we started him on those medicines. We got rid of some of his fluid. He was having a lot of arrhythmia problems. He has a defibrillator, required several medicines. And despite all these treatments, he wasn't getting any better. So we started to discussing putting in this left ventricular assist device, or LVAD. When the heart gets weak, it gets big and dilated. It's kind of like a big baggy structure and it can't contract or squeeze. And this pump actually sucks the blood out of your heart and pumps it back into your body. So it augments your heart and it takes over the function for the pumping part of the heart. And fortunately, he did extremely well. He was probably one of our best patients. Got out of the hospital within 2 or 3 weeks. And now he's hiking mountains, which is pretty amazing.
I love doing hikes in the mountains. So got up early, got there early in the morning, and it was a tough hike because I wasn't completely healed yet, but I was determined to go. And so it was really hard to make it to the top. Keith Hughes coming to you from the high top mountain off the Appalachian Trail in the Shenandoah National Park. Coming to the summit. Oh my God. And my plan was to thank all the doctors that got me to that point. That's what I was originally going to do. And then when I made it to the top and seen the overlook, I just kind of got so emotional I lost it. It caught me off guard. I didn't know it was coming. Sorry about that. I got a little emotional. But look at this. It's awesome. Thank you, Dr. Keller, Joan and his staff, Dr. Gazzoni and his staff, Dr. Johnson, and the nursing staff at Chippenham. Thank you all. This is awesome.
To have the technology to take somebody from death's door and bring them back to life so they can have a relatively normal life, longevity to his life, quality to his life, being able to enjoy it with his family and friends, being able to enjoy it with his pet, those are all really important because otherwise he wouldn't have had any of those things. And being able to do that is very gratifying.
I mean, literally, I reached the top of the mountain, you know what I mean? It's something I was wondering if I was ever going to be able to do again.
To be able to help somebody like that and bring them back to a normal kind of lifestyle and the ability to do things that he wasn't able to do because of his illness. If we didn't intervene when we did, he probably would have passed away. I don't think he would have survived. Now he could have a fairly normal life. So it's an amazing feeling. It's very heartwarming. You know, it really makes you feel good and appreciated for what you do.